What's up, everybody? Dr. Perry Bard here, and in conjunction with, he's here, all right. You know it. He had to jump through some hoops, but he's here live. Dr. Eric Kaplan, welcome to our Zoom meeting tonight. We've got some incredible content to share, to show, to give you. Yes, we're so thankful, we're so appreciative that our family of doctors, our Descendants of American doctors, are here on this as well. This is open to everybody, but we've got some amazing content to share with you. We're going to make history on this one. Yeah, that's a big statement. That's a big statement. So I'll tell you what, let's go right into the slides. I got a good idea. Let's go right into the slides and kick it off. Grab a piece of paper, take some notes. Let's, as we say, go to work. So, where are you? Here we are, right there. There we go. All right. Can everybody see that? Yes, I'm sure you can. All right, beautiful. All right, so we're ready to begin. Let's make sure it works. And there it is. All right, we're going to kick it off live here in the simple fact that a lot of you know that we just got back from Chicago, and it was a sold-out Chiro event, as they all are now. And welcome to the family, all the doctors now from Colorado, California, Illinois, Texas, Ohio. I lost track. There's probably a few more in there. Louisiana, and so much more. We want to welcome all of you to the family. A lot of you are actually on the Zoom meeting with us here tonight. Take out a pen. Dr. Kaplan and I have some incredible content to share with you, to show you, to give you here live. And it's all going to start with one word. The word of the day is reps. I'd like you to write it down, R-E-P-S. Now, a lot of you know that reps is actually an abbreviation for what? Repetition. And in repetition in anything breeds success. If you want to get in better shape, then you better work out a little bit smarter, a little bit better. If you want to clean up your nutrition, well, consistency and more reps in business, reps. But reps, believe it or not, it's not just about repetition. It's actually an acronym. And what it stands for is the theme of tonight, which Dr. Kaplan will take you on the deep dive here tonight. It's obviously, when we hang our hat on medical research, because everything you do should always have quality medical research behind it. So when you sit down with a decompression case and you present medical research from Johns Hopkins, from the Mayo Clinic, from Stanford University, from Harvard, now you're playing at the top of the game, and all your research should be consistent with medical necessity, your diagnosis for the patient, and everything is predicated on what? The MRI, as you know. So it all starts with research. From there, it goes into education. The E stands for education. And the better educated your patients are in the world of spinal disc, do they understand annular fibers? Do they understand protrusions? Do they understand prolapses? Do they understand what a sequestered disc is? Do they know the difference between a bulge and a degenerative disc? Do they understand how that affects the nerve flow to all the cells, tissues, and muscles and joints in that area? And how does that affect function? Well, your ability to educate a patient is really foundational to the ability of your patient getting a better outcome through spinal decompression. And we'll talk more about that. The P, the P stands for what? It stands for packaging. So your packaging becomes crucial, vital. And what does that mean? It means your patient folders, your patient inserts, your patient education tools. Your folders should include a combination of research materials, materials about your brand, materials about your specialty, materials about you personally, materials about your patient base. Packaging is crucial, vital, and important. That's why we spend so much time at boot camps talking about packaging, putting the packaging together. And yes, last but not least, as you know, is systems. Your systems in terms of creating a turnkey system to be able to take the patient from A to Z consistently, to be able to overcome objections, to be able to under-promise, to over-deliver based upon their medical presentation, based upon their spinal disc presentation. And that's what we're going to talk about here live tonight, because we've got some very, very big news. Now, some of you have heard the rumors. For the first time ever, we're going to announce it. I hope you're sitting down for this one. This is groundbreaking. And Dr. Kaplan and I are so incredibly happy to share with you something that is historic for our profession. This is not an exaggeration. It's probably the greatest under-promise and greatest over-deliver ever, because it affects all of you doctors. It affects your practice. It affects your success. It affects your patients, and it affects the future of our profession. Because I don't know if you're like me, but I've been in this business for 38 years. Dr. Kaplan in this business for 45 years. And we love being chiropractors. So much so that our children have followed the path. They're on the Zoom meeting right now. You may even hear from them here live on this Zoom meeting here tonight. So what we're talking about here is the future of our profession. And often you'll hear a word. Sometimes it's, kind of thrown out there loosely. Dr. Kaplan and I talk about it on the highest plane, the highest plateau, the highest stage, because it means the most to us. It's about legacy. The question is, doctor, what is your legacy? Well, now you have an opportunity to be able to literally piggyback off of something that was created for you and for the profession. The profession is actually in great hands right now. It's actually in the best hands ever. And if you're wondering and say, gee, that green color in great, what does that mean? Does that mean money? Well, it could for some of you, but what it really means is this. There is one university. It is the largest university ever in the history of our incredible profession that Dr. Kaplan and I have been aligned with and have been so fortunate, so lucky, so blessed to teach their #1 CEU program for all these years. It is the National Spinal Decompression Certification, which is really the dream of Dr. Kaplan. Dr. Kaplan put this together back in 2012, and together we've been able to do some historic things. But guess what? Wait till you see what's coming, because you ain't seen nothing yet. A lot of people understand when they talk about Dr. Kaplan and myself, because you got people on the Zoom meeting that have never met us before, don't know anything about us, and they're a little bit curious. So often we're referred to in this business as coaches. Yes, concierge coaches. Some people refer to us as consultants, mentors, authors, advisors. We are yes to all the above. But at the end of the day, what we really are is we are educators. And we felt an innate desire and an innate soulful purpose to raise our profession together by creating an alliance with one university that is now positioned to be able to do something historic. For the first time ever, and then we're going to go in actually to the Zoom meeting, but we wanted to share this announcement because we don't want to wait to the end. We wanted to let you know up front before we actually go into the Zoom meeting. And as many of you know, both Dr. Kaplan and myself are the creators of something known as Disc Centers of America. We're the largest non-surgical branded group of spinal decompression centers in the world. Over 250 of them with a waiting list. Many of you know doctors that are part of Disc Centers of America. Disc Centers of America doctors are the leaders in their demographics in terms of saving patients from dangerous opioids, risky epidural injections, and often unnecessary back surgeries. We're actually in over 250 as we speak with a wait list to apply. It's incredible. And one of the things that we're proudest of is the recognition, the acknowledgement, and the endorsement by literally the guy that has no equal. His name is Dr. Norman Shealy, MD, PhD, neurosurgeon, Harvard educator, who gave us his formal endorsement of endorsing our Disc Centers of America doctors. He helped us write the 800-page Bible of spinal decompression. He has no equal. We've got some great stuff with Dr. Norman Shealy we're going to share with our doctors actually on the Zoom meeting. So you better hang out because it'll be worth it, I promise, for all our family of doctors here. And listen, you're a product of the company you keep. So for the first time ever, and Dr. Kaplan is going to speak about this before we actually dive into our Zoom meeting here tonight, is an alliance and an alignment that literally took years in the making. As many of you know, Life University, it is the school that I graduated from. It is the school that so many doctors who are on this Zoom meeting have attended. And they're doing something now that no other school in the country has been able to accomplish. And they worked super hard at this, but now they own something that now makes them totally unique, distinct, and different in the world of chiropractic education. It is what we consider the greatest alignment ever in the history of spinal disc education and spinal disc treatment for patients for many, many years to come. And for the first time ever, we are so proud to announce the official alignment between Life University and Disc Centers of America, where now Life University will have the first ever outpatient clinic that is named in full, totally and exclusively, as a Disc Centers of America treatment center that is part of the university. That is groundbreaking, never been done before by any university. There's been many universities that applied, that wanted this, but it's our relationship with Life University that goes back for many, many years that we're so proud, we're so honored to allow this to happen in conjunction with the chairman of the board, the president of the school, and an incredible team that made this happen, where now Life University is the first chiropractic college branded Disc Centers of America Outpatient Student Education and Treatment Center. All our Disc Centers of America doctors now have a chance to participate in this, raise their star power, raise their authority, raise their credibility. And none of this, trust me when I tell you, none of this would have happened unless the dream of you-know-who, the desire of you-know-who, the passion of you-know-who is really Dr. Eric Kaplan, who championed this from beginning to end, who put this ball in the end zone and allowed us together as a family of Disc Centers of America doctors to win, because now the profession as a whole gets a chance to win. Because listen, anytime you could save patients from unnecessary back surgeries, foraminotomies, laminectomies, spinal fusions, and so much more, you're one step ahead. No longer are you in the back of the bus. Now, guess what? You're driving the bus. Dr. Kaplan, what an incredible treat. What an incredible honor. We could do a whole Zoom meeting on it, but guess what? We got all these crazy cool slides on spinal research, on tools, on materials, on forms that everybody's going to get a chance to benefit from if you're part of our family of doctors, because that's what we love about you, because you're here showing up. Dr. K, take it away.
You know, first of all, Perry, thank you. As they said in a very famous movie, you complete me. Without you, I mean, Perry, none of this could have been done. But, I think that we share something, doctors. I said to my son, and I say this to Perry's son, and I say it to all of my clients and to my non-clients, chiropractic is the greatest profession in the world. I thank God every day that I am a doctor. I would give up everything in my life. And I realize how blessed I am to have the DR in front of my name. Not an easy task. It really wasn't. And with that said, when I graduated school in 1978, listen, I talked the story. I got laughed at. I got ridiculed. My mother wouldn't talk to me for a month. I had an uncle who graduated school in 1920. My uncle Al Brenner never could make a living in chiropractic because in those days they charged $2 for an adjustment. $2. And he couldn't make a living. So he had to go to work for the Port Authority. And when I said I was going to go to become a chiropractor, my mother was distraught. She wanted a dentist. Well, she really got one now because Perry's son is a dentist. So I say all the time, doctors, I said to my son, greatest profession in the world, but it's not the easiest business. And I'm going to tell you why it's not the easiest business. Because we have been trained, well, you have been trained, I was trained to be a salesman, but I hated being a salesman. What I wanted to do, doctors, is be a doctor. I wanted respect. And let me tell you something. Even today, believe me, Perry will tell you, wasn't the easiest day. Why? Because people have to understand what we have done, and I use the word we gloriously, What we have done for the profession, nobody in history has ever done. Matter of fact, we've taken decompression to a level that we're not a machine. Spinal decompression is an event. It's spinal distraction without muscle contraction. Everybody write that down. What is decompression? So I get people with Chattanooga tables, doc tables, acuspina tables, DRX tables. Listen, I love the tables, and I love some more than others. But let me explain to you something. Decompression is an event. Now, if you go back, I'll even take you back in time. Imagine 17 years ago, a study came out by Dr. Alex Marcario from Stanford University. What do I tell you? Dr. Shun Panchel, okay, from Florida Pain Management. Dr. Richmond, okay, and then Dr. Pergolesi from Johns Hopkins. And what did they show? An 8.98 out of 10 success rate. 9 out of 10, but hold on. It took 8 weeks. I was just talking to a doctor today. He says, "Oh, we have 5 treatment plans. One is 6 visits, one is 10 visits, one is 15 visits." And I said, "What is it based upon?" Everything that we do, doctors, we're going to do today, we're going to discuss today, is based upon research. I'll give you an example. The Nagelson study talks about 20 sessions. The Bergmeyer study talks about 6 weeks. The Ramos study talks about 20 sessions. The Beatty study, 24 sessions. Nagawuski, Ironman, 40 sessions. Gehring, 28. Macari and Pergolesi, which I just mentioned, 23 to 24 segments. What about McClare, 20? What about Rendon? Okay, 27. What about Odell? 25. So when you understand, doctors, that one of the great things that happened tonight is thanks to my son and my daughter in love, okay, is I was able to get on this. And this is historic because this is the first time I've ever done this on my phone. We've had some storms in Florida. Who the heck knows? But my internet went out. And I'm sitting there saying, what's the beauty of that? And how can I turn that into a lesson? Because I think what Perry and I talk about is lessons. And I think that you have to understand, doctors, is healing takes time. And I discuss this all the time, that a subluxation becomes a bulge, and a bulge becomes a herniation. Okay? But you know what I've learned also, that if you look at some of the research studies, that what has it showed? 80,000 surgeries fail annually. And you know what I'm saying, doctors? I look at it this way. That's 80,000 patients we could have had. That's 80,000 patients we couldn't educate properly. I've spoken to Tiger Woods' people, who now has had 6 back surgeries. And it's not like he couldn't have the 6 best. And then I look at doctors, listen, most chiropractors go for the least expensive table, and that's okay. I started with training wheels. My first car was a Buick Regal. But when I look at this picture, doctors, what amazes me is I built a practice that saw 200 plus visits a day. Not a week, doctors, a day. Why? I didn't know of decompression then. But I did understand kinesiopathology. I did understand myopathology. I did understand neuropathology. Because what we deal with, doctors, is bone, nerve, and muscle every day. Now, if you look at phase 1, now, doctor, phase 1 is a subluxation. But as I said, a subluxation becomes a bulge. But now let's go to 3 and 4. Look at the degenerative joint disease in between the vertebrae. Look at the osteophytes. Look at how the disc narrows. And I want you to know, doctors, according to Cannell, even after disc surgery, even after a microdiscectomy, what happens, doctors, is now pressure is put on other vertebrae. And the chances of recurrence are unbelievable. And that was done in the Jarvik and Dio study. I mean, that we have to understand that 83 million workdays are lost every year, okay, due to back pain. That back pain is a $1 trillion industry. And Dr. Springer reported that this is ongoing. JAMA, University of Washington, said, you know what? The average case, non-surgical, is $6,000. Yet I'm talking to a doctor today. He charges $1,000, $1,200. So I'm going to ask you, doctors, why? Why are you here tonight? What do you want? How do we take it to another level? Because what we know is, according to the Journal of the American Medical Association, $635 billion are spent on pain management for backs and backs alone. That's not the treatment. That's back management. And we know that now, epidurals are not FDA approved. For back pain, we have to understand, doctor, spinal decompression starts really with you. I don't even know what the next slide says. It starts with you, okay? And yes, the MRI is important because I'll tell you why, doctors. The MRI creates a second opinion. The MRI shows that you're medically oriented. You see, doctors, when I went to chiropractic school, they said, oh, it was the Hatfields versus the McCoys. MDs are not the enemy. Matter of fact, met a wonderful thing from Dr. Steve Novelli, who's on tonight, who has an unbelievable software program that we're going to introduce to our doctors. We have so many new things in the fireworks. Stephen, thanks for being here. And then you got geniuses like John Ziliak that's here, and then you got Deacon, who's going to pray for us today because he calls me 20 times a week. So the point is, Deacon, I want prayers, baby, not for me, but for the profession, because we have to understand, doctors, there's never been a better time for chiropractic than there is now. And you know what the MRI stands for? It really stands for motivation. It stands for results, but it stands for integration, because motivational results create integration, because this creates you as an integrated practice without you even realizing it. Because when I show them an MRI, doctors, an MRI comes back one of two things, positive or negative. Well, if it's positive, doctors, we have to make the transition that we have to do because, listen, the chiropractic industry has changed. Yes, no different than iPhones have changed. You know, these patients often have three choices: opioids, epidural injections, and spinal surgeries. But here's what we know, doctors, all three fail. I mean, do you realize that, and I'll get to the fourth choice, that when we look at the Mandel study, okay, and the Mandel study shows that out of 23 randomized trials of 2,000 patients, epidural injections were compared to the placebo with no difference. That is a temporary form of relief. And yet people will say, oh, I'm not going to do surgical decompression now. I'm going to try an epidural, even though it's not FDA approved. One of the things that we give our doctors, yes, doctors, is a Dr. Oz video done on epidurals, where they say it's FDA approved, but it's not. You see, doctors, a bulging or herniated disc is a condition where tears are allowed. And you have to understand that we have a series in an average disc, doctors. Please understand that the annulus is 10 to 20 concentric rings. I mean, 10 to 20 concentric rings. And, you know, the Boxell Martin study showed that the disc has the ability to heal itself. Now, when you understand the disc has the ability to heal itself, doctors, how do we heal it? Well, one is through oscillation. You know, I'm forever grateful to North American Medical. I'm forever grateful to laser. Why laser? We promote two lasers, class 3 and class 4. I'm grateful to Mike Barber and Microlight. I'm grateful to AJ Singh and Neuromed. Why? Because laser is a magnet of blood. You see, doctors, if there is an annular tear, how are you going to help heal the annulus? And we know even now, after surgery, doctors, even if there's some disc removal, they can't get rid of all the removal. And what happens, doctors, is now if you do L5, then now L4 becomes weight bearing. There is a reason, doctors, why failed back surgery syndrome is epidemic. And if you look at the word, the surgery, and if you look at Dr. Chow, okay, that the odds are minimal. And according to the American Journal of Medicine, that the second surgery has only a 30% success rate. The third surgery has only a 15% success rate. Now, when you're looking at the success rates and that we have 80,000 failed surgeries annually, and then you look at Dr. Dio and you have to say, hold on, why is this happening? Is it because of us, doctors? Are we not educating? We met with a beautiful orthopedic surgeon, I said, from Dr. Novelli, who came down, Dr. Vinya, and he understands that, listen, you need to have an option. The patients need to have options. And guess what? A lot of these things will be seen. Now, are all tables the same, doctors? Of course not. Are all cars the same? Of course not. The FDR 21 shows many of these things, doctors, were originally originated as a traction device. The first one to get FDA clearance was the VaxD. Then came the Acuspina and the DRX. But guess what? They started a company called DRS. Now look at the bottom figures, doctors. What's happening is you're altering, if you look at the bottom left, right? How are you certain of the angle. The the O'Dreary study and the O'Neill study showed doctors that the problem is most companies taught 50% of the body weight, but 50% of the body weight, doctors, on what table? That was a traction study done by Odell, and that was a traction study. But we're not doing traction here, doctor. We're doing decompression. So Shealy, working with Kaladi, okay, developed what we call the fixed tower. That they originally came out through a company called DRS, and DRS bifurcated to become Axiom and North America Medical. And I've learned a lot from North America Medical. I'm not going to tell you, listen, Larry Rubin to me is a great guy, but we argue. Listen, I want people to know that without Dr. Bart and I, okay, we people wouldn't even know the differences in tables. But we mandate that our doctors understand. I don't care what table you have, doctors, but you better be an expert on your table. Meaning, who would have thought that Ford would have won the Le Mans? They understood the car and they understood how to make that car better. It wasn't a Maserati or a Mercedes. Ford won. But what I'm telling you, doctors, yes, with a better machine, you have better results. You know, people don't realize that Steve Atlas did from Harvard University that said that very few people have no pain after a spinal surgery, especially after a fusion surgery, meaning that you can have surgery, doctors, and still have pain. This is a wonderful chart that we give to our clients. And what this chart, doctor, shows is that healing takes time. And that was shown by Thornberry. That was shown by Ironman. That was shown by O'Neill, because we know, doctors, and no different. Let's take tonight, for example. I couldn't get on the internet. And if it wasn't for my son, I would not be here tonight. For some reason, we've had storms in Florida. My internet was down. But thankfully, my son took me through it. But here's what I said at that moment. I said, not every case, doctors, is going to be easy. You know, we're not Ron Popeil. We don't set it and forget it. You can't go to 50% body weight and expect to be well. So what's the difference? You have to know the machine that you have. You have to know what the FDA clearance says on your machine. You have to know whether you're dealing with the patient prone or supine. You have to know whether you have a fixed tower or you don't have a fixed tower. You have to know what to do after decompression. Do you do EMS first or do you do EMS after? Now, we understand the power of ice. We understand the power of laser. We understand the power of electroanalgesia. Okay. And what we do to our doctors is not make them better salesmen. Everyone who knows me will hear this all the time, is now that healing takes time, whether it be a muscle strain, a tendon injury, a ligament injury, or other tissue. But I mean, let's look at that. Muscle strain, 2 to 8 weeks. Everything with so why would somebody sell a 6-visit package? Why would somebody sell a 10-visit package? And what about ligament injury? Can you have kinesiopathology without myopathology? That means that muscles and ligaments and tendons get involved. And then when you have, cartilage or meniscus, okay, that's why now one of the programs that we do is knee programs. And I have a matter of fact, one of the doctors who is one of the heads at Life University sold 3 knee packages this week. That now there's an AccuKnee. Now some people say, well, what's the difference between the knee on track and the AccuKnee? Good question, Jason. I'm glad you asked. The difference is the knee on track is FDA approved for exercise equipment. The AccuKnee, developed by North America Medical, is FDA cleared as a medical device. Doctors, we work with Sal LaRusso, who's on a cruise right now. Sal's probably one of the number one expert witnesses in the world for NCMIC. One of the things that Dr. Bard and I do on a daily basis is we want to prevent our doctors from being sued for malpractice. Yet, disc injuries is one of the top 2 things that people are sued for. Now, when we talk about the Boxell-Martin study, okay, it shows that disc has the ability to heal itself. When we talk about the Sherry study, when we talk about the Krober study, when we talked about the Shealy and Perry study that understood the split tables and flexion at the knees, that comes from Shealy and Perry. And what we did is Perry and I, okay, working with our son, okay, we wrote the definitive book. I don't know, Perry, can they see this?
Yeah, they could see it. You bet.
I mean, it's 800 pages and probably 20 pounds.
It's
I never
heavy.
weighed it.
Don't get a hernia. Be
I
careful.
never weighed it. But, why did we do this, doctors? Because, don't you hate if an MD says, oh, my medical doctor doesn't believe in chiropractic? Well, does he understand that the differences? What about MRIs? We provide charts and things to our doctors that nobody does. See, this are not just a business for us. For Perry and I, it's a life. For my son and his son, it's a life. Doctors, is it unique, Perry and I talk about, that all four of our sons are doctors? Do we not believe in what we do? How many coaches out there, doctors, they're out of practice. They don't practice anymore. They sell bullshit. Yeah, bullshit. But yet every day Perry and I live with our children that are out in the field grinding. And like I said, no different than the internet doctors. What do you do when the patient does not heal as quickly as possible? Do you know how to educate them? Do you know what research studies to give them? Do you show them the Pergolesi study? Do you show them the Shealy study? Do you show them the Boxall Martin study? Do you show them the Ironman study? And imagine that the Leslie study shows 6 weeks. What about the McClure study? The McClure study had a 91% to 92% success rate. And even after a year, doctors, 89%. These are amazing, amazing numbers. Okay. And when you realize, doctors, that decompression is not just a therapy, it's a science. You have to know your machine. What research was done in your machine? The McClure study was actually done on the Acuspina. The Leslie study was actually done on the DRX. The Pugliese study was done on the DRS, which was at one point the birth before the others. Perry and I, listen, when I graduated, doctors, there was no such thing as the Odell, and it's actually the Odell and Boudreau study. And they did this together. It showed 4 excellent results 4 years later, which meant that even 4 years later, people are doing well. And I'll tell you, doctors, anyone that comes to our thing, let me tell you, I will show them my MRI. I will show my poor son how to deal with, because when I got on the table. But Perry gave you the word to write down in the beginning, which was reps. So I'm going to ask you to write down one word now. So let's take a 30-second one break. I want you to write down the word care. CARE. Because you see, doctors, we're in the care business. So the care, here's what we do. We do what we call the Chiro event. One of the things that I give at the Chiro event to all my guests, besides giving a disc of the student edition of the book with all the research studies, we give them videos called the 3 C's. 3 C's are the capture, the conversion, the close. Because that's the business you're in, doctors. Capturing new patients, converting basic patients, and the close. But you know what? It's a science, doctors. And we teach you how to master that science. But if I take the word care to do a close, how do you do a close, doctors? You have to care. Do you care? Everybody who cares, raise your hand. See how simple that was? See? And if I took my fingers, okay, the secret to every close is 5 fingers. It's all in your head. It's all in your head. That's my 5-finger tool of success. If you think that they can't afford you, they can't afford you. If you don't know if you can help them, you can't help them. If you think that they're out of your league, they're out of your league. But let me tell you what care comes down to. The C in care stands for, doctors, confidence, commitment, and clarity. 3 more C's. You got to know your research. If you become a partner, if you become aligned with Distance America, if you become aligned with Life University, why did they choose us? There are other companies out there because nobody's better. And a lot of people, Perry, that they don't like when I say that. Nobody's better. And I'm proud of the work that Perry and I did. We took spinal decompression to another level. And all of my clients, and we have clients with 30,000 square feet. We have clients in Hawaii. We have clients in Alaska. Why us? I'll tell you why. because we understood the science of it. We're not selling a machine, we're selling a science. And you have to understand as we go through the Shealy study. Okay, now this was another Shealy study that showed a 70% success rate even after a year of, well, hold on, but the secret is when other surgeries and options fail. And let me tell you something, doctors. That's why we teach a retention program, because we realize, chiropractic would always say, oh, maintenance. Well, maintenance became a bad word because insurance didn't agree with it. But you know what? Dentists understood retainers. You go for braces, you need a retainer. I mean, we understood, the difference. And Shealy with Weisman did that. Now, this is the Bergmeyer study. The see, I don't even have to look at the study and I know what it is. 86% of ruptured patients had good or excellent results using decompression therapy compared to 55% for traction. But hold on. What it doesn't tell you, if you read the study, for traction, they never had excellent results. Never. Never. And there are tables out there that are traction tables. But let me tell you something. The business that you have to decide, doctors, what business are you in? Do you want to be, Perry, can they see this?
Yep.
You want to be in the Invisared business? And we have doctors that spend $30,000 and $40,000 on LED and lasers to do Invisared. Now, let me tell you something. I was the president of Nutrisystem. I don't think anybody in this room, outside of everybody in this room, knows more about weight loss than I do. That was a business, and it became a billion-dollar business. But you know what? I never loved it because I love chiropractic. I love that we can take a hard bone off of a soft nerve. I love that we can increase the energy of the body. I love that we can create a dynamic so different from anybody else. I love the fact that I can touch people and heal people. I love the fact that every day I awaken and I say, "Oh my God, I can touch somebody's neck and I can tell if they're subluxated, and now I can help people and prevent people from having surgery, where I know that 80,000 surgeries fail annually, that I know that 1 in 50 back surgery patients dies within 3 years of surgery." Now, hold on. But now, of the other 50, what about the other 49? They still suffer from pain. Jarvik and Dial at Washington State University will show you that. Okay? There is so much that we can do, doctors. You know, Everybody should take a picture of this. I believe at the end of your close, you let them listen. If you think surgery is an option, is this an option that you want to choose? I promise any doctor that's on this call, if you work with Perry and if you work with my son, I will help you close more cases. What's one case worth to you? What's one decompression case worth? You see, doctors, first of all, I want to applaud you for being here tonight. What am I being paid for tonight? Nothing. Let me tell you something. Oh, we're doing this thing at Life University. What am I being paid for it? Nothing. I do this for my legacy. I do this for my profession that's giving me everything in the world. I have the greatest partner in the world. I have the greatest wife in the world. I have the greatest children in the world. I have the greatest daughter-in-laws in the world. I mean, I owe no money to anybody. I live a life that people dreams of, but I did it through a profession that my mother laughed at. I did it through chiropractic. And I'm telling you, doctors, we have to make a stand. I mean, are you for surgery? Because let me tell you, the back surgery statistics are not good. 74.5% of low back surgeries fail to alleviate the back pain. So if anyone watches the video that we did, that we show with Dr. Timothy Kremchek, and we show it, who Jason treated, Barry Larkin. Barry Larkin had neck surgery, but then they told him, well, hey, now we're going to do a fusion. And he chose to see my son and get treated and never had the fusion. And that's why we look at things like the Bayburn-Erdick study at a James Hopkins, that post-operative back pain is not unusual. That's out of John Hopkins. They understand that. Doctors, this is the alternative to what you do. And if you want to charge $1,000 for that, you do that. But if you come into my world, if you come into Perry Bond's world, hold on. Why do we do knees? Why do we do neuropathy? Imagine that one doctor today from Life University, a big league, signed 3 knee cases today. You see, doctors, let me tell you what it is. I said this to Devin Bard, bar mitzvah. If you see the invisible, you can do the impossible. And really that came from Walt Disney, not from Eric Kaplan. Because Walt Disney used to make everybody touch their temples and said, your imagination creates your reality. Everybody put your finger up, touch your forehead, and say, my imagination creates my reality. What do you want, doctors? What price do you want to pay? What is success to you? Let me tell you what success is to me. Success is to me that people will know that when it comes to back pain, that we're the solution. We're not just an option. Meaning, why should chiropractic be alternative care? Surgery should be the alternative. Decompression should be primary. Barry, go ahead.
Yeah, baby. Yeah, baby. Let me see. Where are you? Did I lose you? Where are you? Right there. Oh, there you are. Boom. Hey, do you like the hat? Did anybody comment on the hat tonight?
Do you know Brahim's already makes plans? He's already flying out to Colorado to meet with me.
That's the rumor. I heard he's going to Aspen to meet you there on your private plane. How many people know that Dr. Kaplan's flying on a private plane to Aspen? Not that many people, right? The word is out. The word is out. Now, I'm going to tell you something. Then I'm so thankful. I'm so happy. I'm so blown away that all of you have stayed this entire time, because listen, I've been on Zoom meetings too, and sometimes you get pulled on the left and you get pulled on the right. There's more people in this room right now than when we started. Congratulations to you. A mainstay of you, Artist Centers of America doctors, family first, always, always. And yes, my phone is blown up like it's never blown up before, because I guess can I say this, that we hit a nerve? I guess we hit a nerve. Pun intended. It's a big deal. Yes, that Life University will now be the first chiropractic college in the history of the profession to have an outpatient center that is branded exclusively as a Disc Centers of America center, which now becomes a training center for all of its students, for all of its prospective students. I know personally, if it's me and I'm shopping chiropractic colleges, and I know that Life University has a disc center that will teach me the biomechanics, the physiology, the anatomy, the medical research, the Shealy study, the Shealy-Bergmeyer study, the Leslie study, the Ramos and Martin study, the Pedruzzi study, and so much more. We're going to give you what we call the weapons of mass production. You want to explode your practice? Doctors that are on here, right now, take out a pen. Right here, right now. Take out a pen. Winning begins right here, right now. I want you to write this down. You ready? www. The Chiro event. TheChiroEvent.com. Now on Saturday, September 6th. And I'll show a slide for this, so don't worry. I'll show a slide for this. And then I got some gifts for our family of doctors that have never been seen before. So thank you for hanging out. It's what we do. And you keep paying it forward because you deserve it. You're the torch carriers in your demographic. You're the ones that are saving patients from bad outcomes. You're the ones that invested in technology. You're the ones that invested in your education. You're the ones that invested in your time with us right here, right now, together, as we make history together, because that's never been announced before. Yes, there'll be press releases. Yes, there'll be media. Yes, there'll be covers of magazines. Yes, there'll be video. Yes, it's a national story. But the reality is that Life University now is the first chiropractic university to put an emphasis on the education of their students in the realm of non-surgical spinal disc disease, disc disorders, spinal disc decompression, where we're bringing in a all-star Hall of Fame lineup to teach their students. How exciting if I'm a student at life, right? Unbelievable that now, instead of coming out of school with 100, 150, $200,000, $250,000 in debt, that you'll be able to pay off your loans by running a cash program. Imagine a cash program. How crazy is that? So let me see. How crazy is that? I know you have a question. That I know who you are, and you're part of our family. So you can text me right now, and we'll answer your question. So thank you for doing that. Imagine you want? Can I do this before we jump into the slides? Can I? Is it okay? Give me a yes. Can I do what I'm about to do? Yeah. Imagine for a second, for 1 second, coming out of chiropractic college. Think about this. And owing $250,000. And now you're going to take a job at the Joint? Think about that. You're going to go take a job at Snap Crack Pop? Yeah, that's a franchise. You're going to go take a job at $20 chiropractic? Drive around Atlanta, you'll see that. You're going to take a job there? I promise you, you'd pay off your loans if you took a job at Little Caesars, Pizza Hut. Fact. If you were an Uber driver, fact. If you were a DoorDash driver, fact. You'll pay off your loans quicker. The reality is this business, this profession is the haves and the have-nots. You want to see the haves? I'm looking at them. I'm looking at Dr. Mitchell. I'm looking at Dr. Falkenberry. I'm looking at Dr. Dickinson. I can go on and on. It's that cool. Oh, you ain't seen nothing yet. We're jumping back into the slides. But the fact is this. All boats rise when the tide gets higher. All boats rise together. All of our family of doctors, which we are so motivated by. When I look at Dr. Mitchell, repping the brand, yeah, the only thing he's missing, you know what he's missing? He's missing this. He's missing the water. See, if you had the DCOA water, you would be, but listen, it's coming. That's the only thing you're really missing. Let's go back into the slides, Dr. K. I have some slides on epidurals that I would love for you to talk about, but write it down one more time, www.thechiro.net. Now, if you're part of the family, you want to come to boot camps. Now, the Friday, September 5th boot camp is completely closed out. We just added a new date, so because of demand, as you know. So remember, if you're part of our family, you never pay to come to the Chiro event. You're grandfathered in based upon seat availability. But boot camps are everything. Friday, September 5th is the boot camp if you already have a seat. Saturday is the Chiro event. It's open to everybody who can get a seat if it's not sold out or closed out after this, which I have a feeling it will be. So I want to go back into the slides because then I have some gifts that I want to show, share, and give our doctors that have never been seen before.
Barry, I one of the things I want to do, and I know you're going to get mad at me, but everybody's gotten mad at me today, so I really don't care.
It's love. It's tough love is what it is.
I know that we only have 3 spaces left for the Chiro event on September 6th. Is it the 6th?
September 6th. That's right. Yeah.
So what I want to do, okay, and here's what I'll do. On September 6th, there's only 3 seats left. The first seat, okay, the first person that calls that wants to come to that event, I will pay for their seat and make that donation to Life University. So the first person that calls and that we grant a seat, okay, I will pay for that seat myself personally, and that will go towards Life University. And I'll tell you, the amazing thing about Life University is they made an understanding of how children, doctors, are graduating school with $250,000 or more in debt. And you know what? It's scary. I was scared, but you know what? It's scary now. And what we have to start doing, doctors, when you talk to epidurals, as I said, 2,000 patients with epidural injections, and we realize it doesn't, and that's the one study. If you look at the Mandel study, oh my God, the Mandel study shows, watch what I'm going to tell you. The Mandel study showed the incidence of vertebral fractures was assessed. Researchers discovered that increasing numbers of injections was associated with an increasing likelihood of fracture. Each successive injection increased the risk of spinal fracture by 21%. Hold on. So your people don't realize that they can get avascular necrosis, that when they go for an epidural injection, every time that they get an epidural injection, which we know from the first study, okay, the Plano study, that we know that the study shows that it's only going to give temporary symptomatic relief. It's basically a corticosteroid. But then you look at the Mandel study, oh my God, 21% chance of having spinal fractures? Are you kidding me? Both American and European guidelines, based upon reviews, show that epidural cortisone injections may only offer temporary relief to sciatica, but do not reduce the rate of subsequent surgery. So what does that mean? What it means, doctors, is they go for the epidurals, they get temporary relief, then the pain comes back, and then they go for surgery. This is your fault, doctors. See, if you don't know the science, if you don't know the research, if you don't know the Nagelson study, the Odell study, the Boudreau study, the Ironman study, the Boxell study, the Martin study, the Kirkley-Williams study, that you have to know that expanding epidural decompression is a problem. That single lumbar fusion, doctors, okay, can be $26,000. That 50% of all bankruptcies in our country are due to people that have medical procedures. Nothing comes, doctors, without side effects, and nothing comes without co-payment. Co. So when I talked about earlier, doctor, the word care, what did I mean? To do a close, doctors, because let's talk about the 3 C's: the capture, the conversion, the close. Confidence, commitment, and clarity. If you can't do that in a close, doctors, it means that you're playing at the game. If you don't know how many visits, you have to know your table. I will teach you that. Perry Bard will teach you that. My son will teach you that. What we do is we offer a family. When Perry and I say that you're part of the family, it's because we're a family business. That's what we are. We don't do this for the money. Dr. Perry Bond, he retired, I think, at like 40 years old, maybe 45 years old. I had to beg him to come out of retirement because I said, Perry, I can't do this alone. Here's a human being that used to get 20 new patients a day. Okay? Devin, if there's any person to be proud of your dad. He doesn't do this for the money. The guy he has private ocean access to his home. Are you kidding me? People would cut off their pinkies to live the life of Perry Bard, and yet he is one of the two hardest working people that I know. The other one happens to be me, but who's bragging? The other part of care, authority. See, if you want to be the authority, doctors, if you want to have confidence, commitment, and clarity, you have to have authority. And then, doctors, the R in care stands for research. You have to have confidence, commitment, clarity, authority. You have to provide research. And then the E, doctors, stands for excellence. Excellence in technique, excellence in practice. Let me tell you, doctors, the bottom line. There's no such thing as bad leads. There's just bad closers. There's just people that don't know how to close a case. Why do you think so many people are going to PRP? Why do you think so many people are going to Invisared? Not that those aren't helpful, but I'll tell you, even PRP, doctors, it treats the symptoms, not the cause. If somebody has a herniated disc, doctors, only chiropractic and only decompression can treat the cause. We're in the business, doctors, of not treating symptoms, treating the cause. So I see that we have a message from Dr. Bard. Give him the message.
I guess we have a message. So yes, we have a message, and it's actually a great message because remember before, let's roll the tape back a little bit. Remember we talked about reps. Do you remember we talked about what reps stood for? Research, education. But remember what the P stood for? Raise your hand if you remember.
Prosperity.
Prosperity. You are obviously paying attention and you get a special gold star for today. But what it stands for is packaging. Now, what we do is we put a lot of time, energy, effort into the packaging of your presentation, of your program, to be able to allow your prescription. Those are the 4 P's. Did you catch that? The 4 P's. Now, notice we said prescription. We didn't say recommendation. We didn't go in the room. Angie didn't go in the room and say, Dr. Mitchell is recommending Mrs. Jones that you come in to see him 20 times, 25 times over the next 8 to 12 weeks. It's not a recommendation. A recommendation is, forgive the term, it's an old chiropractic word. Who wants to use an old chiropractic word? We use the medical jargon, and the reason we use the medical jargon is because you're using medical diagnostic testing. You're using medical radiology reports. You're doing you're living by medical standards and guidelines to be able to educate the patient. So you got to use the language accordingly. So when you advise a patient, often we use the verbiage in terms of prescription of an MRI, prescription of a non-surgical spinal decompression program. Let me show you some forms here that will help the cause here. And when I say help the cause, what I mean by that is to be able to help you put your package together accordingly. And then we've got some gifts for you. So let me see if I can jump right back in here and see if I can find it. Yeah, baby, let's go. All right. So there's 3 forms that we would love for you to pay attention to. 3 forms. Form number 1 is what we call the Q&As. This form should be in every new patient package, because if you can answer questions before a patient asks them, you're 50% of the way home. It is so vital, so crucial, so important. And as Dr. Kaplan often says, a close takes place 2 times. It takes place in your office, and it takes place when the husband, the wife, has to go home and or their significant other and explain to them that they spent fill in the blank for fill in the blank. So it becomes important. There's 2 simple forms we use. It's actually a front back that we use. The second form that we use is also called the activities of daily living. This is vital. This is a form that needs to be used on day 1, because remember, often we do a 2-day procedure. We teach a 2-day procedure at boot camp. And for those of you who have seats at boot camp, congratulations. You're going to love it. You're going to be blown away. Wait till you see all the new content, tools, material that we're bringing in, having made for you specifically for that day, never been shown before. In addition to that, we also love the back index. Now, Dr. Kaplan mentioned a great doctor before. His name is Dr. Salvatore LaRusso. Now, for those who don't know, Dr. Salvatore LaRusso is Chairman Emeritus of the National Board of Chiropractic Examiners. He is part of the lead defense team for NCAMIC. In other words, he defends chiropractors. One of the first things, if you talk to Dr. LaRusso will tell you that the first place that he goes when he's looking at a patient record is he's looking at the forms. He's looking at the intake forms. He's looking at the informed consent forms. He's looking at the other forms that we use in our battery of forms that you'll receive at boot camp. We can't wait to give them to you, that are all dynamic. When I say dynamic, meaning they are in real time, meaning they are specific to 2025, meaning they are guided and they are directed to protecting you as the doctor and protecting the integrity of the care and protecting the safety and insurance of the patient. That's the goal. The goal is to always make sure we're doing what's in the best interest of all of our patients, because remember, these are tough cases. These are patients that have already met with physiatrists, orthopedic surgeons, neurosurgeons, pain management specialists. They're looking at you as another option and potentially a much better option. These are the forms. If you send us an email at newpatientnow@aol.com, I will send you these forms in the highest resolution that you could print out right there. In addition to that, we also have some special gifts for you. We have a new series of posters. Now, obviously, for those of you who have been paying attention, and I know all of you have, You learned about Dr. Norman Shealy. Dr. Norman Shealy wrote over 500 research papers, 500, with the largest majority of them in the realm of non-surgical spinal disc disease. And he's the one who actually carried the torch to really champion this cause, to be able to give patients much better outcomes. He learned early in his career that scar tissue, fibroblast, secondary grade tissue is really the culprit. In other words, you can have the best surgeon, you can have the best facility, you can have the best technology, you can have the best environment, you can have the best training, you can have all the best of the best, and the surgery could still fail because of occlusion to the neuroforaminal space, because of the fibroblast, because of a heightened level of stenosis. Because once stenosis, now how many MRIs do you order, doctors, where stenosis is part of the equation? Do you communicate that? Do you use spinal models? Do you use anatomical models? Dr. Kaplan is actually using new models now at boot camps, teaching, sharing, showing, and giving doctors the tools necessary. So send us an email if you're part of our family. If you're not part of our family yet, you want to go to thecheiroevent.com. Go to thecheiroevent.com. If you're not DCOA, if you are DeCentrus America, send us an email at newpatientnow@AOL.com. We will send you these camera-ready, high-resolution posters. You can put them in your patient packages. Yeah, you can build up your patient packages. These are all brand new. The resolution is great. They're gorgeous. If you saw our son's office, and some of you will visit our son's office, who opened his brand new office, by the way, 2 weeks ago, 14 new patients in the first 2 days. Yeah, we'll teach you how to do that too. Most chiropractors, as you know, they try to bait one hook and one line. They try to fish in one part of the lake, try to get one type of patient. And guess what? I got 2 words for you. No, it's not those 2 words. It's good luck. Good luck. You need a lot of luck, because if you're trying to capture that one patient in that one part of the lake who meets the perfect profile, it's not happening. What's happening? Welcome to our world, where we take the widest net. We throw the widest net in the deepest part of the ocean, and then we filter patients down based upon presentation, based upon medical necessity, based upon facts, based upon medical findings, based upon age, based upon demographic, based upon vocation, based upon symptom profile. Yeah, baby. That's called bluefin tuna. I don't know if you eat sushi. I do once in a while. And I don't know if you know, but bluefin tuna is the best tasting tuna. Actually, toro is the best tasting tuna. And when you look at non-surgical spinal decompression cases where doctors routinely are charging $4,000, $5,000, $6,000, $7,000 a case, yes, doctors do that all day long in the world of spinal decompression. In our world, it's simple. Is it a disc or is it a nerve? Is it spinal structural? Is it biomechanical? Is it visceral? Is it metabolic? This is the best part of being a doctor, because some patients are neuropathy patients, some patients are disc patients. We teach both of those. And if you're fortunate enough to grab a seat, September 6th, www.thecheiroevent.com, you're going to see stuff you've never seen before. We had to do this. We were literally forced to do this because we had such a high demand coming back from Chicago, where it was completely sold out. Look at the Horseshoe, not one seat available, completely sold out with a wait list. And a lot of you that got closed out, we apologize to you. But what we did was we gave you first access to September 6th, and you simply took advantage of it, and you grabbed those seats. There are so many doctors. As a matter of fact, this doctor right here on the left, Mark Lesagio, the king of knees, he will be there September 6th. So many great superstars that have attended the Chiro event. They called it the game changer of their business, their practice. Dr. Cunico in Jersey, 5-star, incredible, drop-dead DDG office. The great Dr. Brian Hesser, 30,000 square foot facility. Incredible Dr. Jason Davis, who reinvented himself in North Carolina, who had a multi-million-dollar practice, sold it, and said, I love being a doctor. We love having him part of our family. Great Dr. Shoemaker, who went from practicing out of her house to an office that'll knock your socks out. the great Dr. Kim Seiko, who moved into a brand new building, has more decompression tables on the way. Yes, I did see the video. I love your Instagram stuff. The great Dr. Kim Hong, who has 2 clinics actually in Louisiana, who does incredibly well. The great Dr. Troy Drawling, the king of spinal research, who practices in Vancouver. I can go on and on. All these doctors attended the Cairo event. All of these doctors took advantage of it. I want you to write this down, 888-990-9660. That's the hotline. Now, if you get closed out, if you go to the website and you see a pop-up that says, we are sorry, it is closed out, do you want to go to the wait list? You'll be given an option to go to the wait list, because once in a while a seat opens. Unfortunately, the past 2 times it did not. But if it does open, you'll be given first access. But we also know the truth. And the truth is, it's hard to book a plane ticket sometimes 24 hours before. So call the number, 888-990-9660. Speak to our team. Speak to Michael. Speak to Lacey. Speak to Stephanie. Speak to Amy. Any one of our team members and our new team members, thank you for being so incredibly focused on our family of doctors. September 6th is the date. It will be completely sold out if it isn't already. We're going to blow your mind. You're going to love it. We're going to give away tools. We're going to give away content. We're going to give away materials. We're going to put books in your hand. We're going to give you medical research. We're going to give you over 1,000 pages of materials. There's no contracts. There's nothing to sign. There's no pressure. Come, dine, eat lunch, have a gourmet lunch, hang out with the most entrepreneurial, business-minded, disc-centric doctors in the world. And yes, we will put these other materials in your hand. We'll put a 200-page workbook. We're going to put the 400-page Awaken the Wellness Within. We're going to give you the game plan with ads and forms and scripts and things like that in our spinal decompression handouts. We're going to give you the 5-minute motivator. We're going to give you a veterans package so you can get into veterans groups. We're going to give you the 1-minute motivator. We've got so many great things. And coming back to the greatest alignment, because my phone is, I can't say that's what happens. You see that? The phone lines are lighting up right now. Thank you, because you know I can't take that call, but somebody else will take that call. See how that works? That's very cool. The phone lines are already lighting up. That's how that works. 888-990-9660. Jump on it. This is your time. The greatest alignment in history. Life University took a leap of faith here, but they trusted their heart. And they said, you know what? We've been teaching this indirectly. Our students want more. Our students want to be credentialed. Our students want to be authorities. Our students want to come out on offense, not defense. They don't want to work for the joint. They don't want to take a job somewhere else. They don't want to, listen, they want to live the life. They want all the things that Dr. Kaplan, myself, and so many of you own, which is freedom. Freedom to do what we want, when we want, where we want, with whom we want, for as long as we want. Yes, we live on the beach. Yes, we live within 2 bodies of water. Yes, I could have never dreamed about this life. You know why I had this life? I don't know if you know. I was Dr. Kaplan's associate doctor 38 years ago. I said, I'll never let him out of my life. He's the greatest business mind in the history of this profession. This profession has never had anything to this degree. Fact. He's carried the torch for this profession in the realm of non-surgical spinal decompression when it was the Wild West out there. Fact. He gets up earlier than everybody else. Fact. He stays up later than everybody else. Fact. I speak to him every day. I do. And every time I speak to him, I get a rush of adrenaline and energy and focus. And that's what he does. See, if you come to the Cairo event, this is what you're going to get. Life University decided that they want to make an investment in the future of the profession. Life University said, we're going to align with the #1 largest group in the history of the profession that does it for the right reasons. Trust me.
Barry, can I say something?
100%, brother. Please do.
I want people to know that we are not charging Life University. Yes, we're not charging them. That Dr. Bart and I, my son and his son, we've donated our time to Life University. Why? Because our profession no longer has a middle class. People are making it and people are not making it. So when they came to us And they said, how much do you want? We told them that we would do it as our gift. And that's why my gift tonight, the first person who comes to the event, I will pay their ticket. Why? Because that person wants to be better. You see, doctors, at the end of the day, it comes down to one thing, as Dr. Bard would say. What's one new patient worth to you? Here's my promise. Every patient, every doctor that comes to the Cairo event, I will guarantee them one new patient, or I'll give them their money back. One new patient. What's one new patient worth to you? If you talk to my son, he's going to say $4,800. You know, there's a cost to success, doctors, but that's not just in money, it's in time. You know, I spoke to Dr. George today. We talked about every day you wake up, doctors, you got 86,400 seconds. What are you going to do with your time tomorrow? I'm giving you 86,400 seconds to say to yourself, you know what? I can do more than what I'm doing now. I can be better than I am now. What's one new patient worth to you, doctors? Let me show you how to increase the value. Let me show you how to increase your practice. Let me show you how to increase your passion. Let me show you how to increase your mojo. Let me show you how to love chiropractic again. I'm Dr. Eric Kaplan with the greatest partners in the world, Dr. Perry Bard, the greatest son in the world, Dr. Jason Kaplan, saying, you know what? Here's an opportunity. But remember this, doctors. When opportunity knocks, you have to open the door. So I'm saying, open the door to your future. Life University chose us for a reason. The reason is nobody does it better. Nobody does it with more passion. Nobody does it with more commitment. So as you go to sleep tonight, ask yourself this question. What's one new patient worth to me? And I guarantee you I can put that in your office. And if you realize that, what's one a week worth to you? What's one? And that's just decompression. What about neuropathy? What about knees? Imagine one doctor closed 3 knees this week at $5,000, $15,000 in a week just on knees. Now imagine if you close 2 in decompression, 1 in neuropathy. There's never been a better time. I have 2 sons. One's a chiropractor, one's a medical doctor. My son, the chiropractor, makes more money than my son, the medical doctor. Now, listen, in life that can change. Why? Because I'm helping the medical doctor reinvent himself. But what I'm saying to you, doctors, is this. As Dr. Bard knows, who put his son in practice, who's the best father I've ever known, who's my muse, that doctors, life's about decisions. Life's about choices. What do you choose today is going to affect everything that happens to you tomorrow. I choose to make chiropractic the #1 profession in the world for disc injuries. I choose to make my son the happiest kid in the world so that he will have for his family what Perry and I have for my family. I choose that all of my clients, like Dr. Falkenberry, like Dr. Ziliak from Niagara Falls, like Deacon, like Mitchell, oh God, by Hillman. Hillman has 6 tables. I mean, if you have 1 decompression table, doctors, you're playing at the game. Let me take the training wheels off of your bicycle and let's get into the real world of decompression. I'm Dr. Eric Kaplan saying, I hope to see you on September 6th.
Write the number down, 888-990-9660. I don't know how many seats are left, but if I'm you, I am calling the number. I am going back to the website. I'll show one more time because I know you guys always think I rush through it. Hey, come on. America's Got Talent is on tonight. It is my favorite show. You know it is. If you've been
Mine
following
too.
me, you know I love that show. And they're getting ready to go to the live shows soon. And then I mean, I think this is the best season ever, but but hey, listen, that's just me, you know. September 6th. This will be a Cairo event like no other. And for all the doctors that got closed out in Chicago that jumped all over this, congratulations. I promised you we would do this for you. And it's the same training we gave in Chicago, but we have some new materials we actually added to it because that's what we do. We always make every training different, bigger, better, more content, more information, more tools, more ammunition. And it makes it so much fun for us. The reason we do it is because it makes it so much fun for us. Because I always say, doc, you've heard us say it, who's having more fun than us? I don't think there's too many doctors out there that are having more fun than Dr. Kaplan and I. Anyone who gets around us knows that it's infectious. Everyone who gets around us comes away better. But guess what? That works both ways because we're the lucky ones. We're the fortunate ones. We're the blessed ones because we attract a certain type of doctor. If you want to go out and say, you know what? I'm waiting for the next accident case to hit. I'm waiting for the moon and the stars to align. I'm waiting for I'm waiting for that. Hopefully, I've heard doctors often listen. What do? They call AT&T and they say, "Huh, is my phone working still? Is my phone lines down? I'm not getting any calls. I don't know why." Well, the reason why is because you're not using the right tools, the right ammunition, the right structure, the right focus, the right funnel, the right portal of entry, the right brand. We teach you that at the Cairo event, how to do that. We put tools in your hand. We give you examples of so many things. And oh my gosh. And so before we go, actually, I'd like to speak to somebody here. Yeah, I hope he can unmute himself because I want everybody, put your hands together. I want you to put your hands. Go ahead. Everybody put your hands together. I want you to clap. Just do it for me. Thank you. Thank you. Just do that for Dr. Jason Kaplan. Yes, Dr. Jason Kaplan. This doesn't happen. That was good, right? That was pretty. Now everybody's clapping, right? It's like silent, right? Thank you, everyone. Dr. JK, would you be so kind? I would love for you to just come on a second. And I would love that Maya was on. I saw his beautiful daughter was on. And I would love for you to share, in essence, why you are having the most fun in practice now than you've ever had before, and what makes your practice dynamic radically different than just about everybody else.
So I'm having the most fun now because I'm working smarter and not harder. I used to kill myself. Adjustment, side to posture all day long, anteriors all day long. So it's really nice to work smarter and not harder. What makes my practice unique is almost every patient that comes in is a disc patient. So this amazing doctor taught me this one line, and it changed my entire life. All roads to disc. So when I have a patient come in and they have a neck pain, a shoulder pain in the back, an upper back pain, I order a cervical MRI. If I have a patient who has right SI pain, low back pain, sciatica, I order a lumbar MRI. And I can classify almost every single patient with a neck pain, upper back pain, a lower back pain, sciatica, neuropathy into a disc patient. Then I ordered the MRI, and it just changed my whole entire practice, how I treat patients, and success rate went through the roof. It's amazing when you have people that have been in pain for 15, 20 years that hug me, and they're in tears because for the first time in their life, they can actually do things. They can be with their children and go out. It's just, it is the most amazing tool. So Dr. Bard, thank you for everything you've taught me. Thank you for all the tools you've actually given me. I'm having the most fun ever because of you and everything that my father have actually taught me. You guys are the rock stars of rock stars. Thank you.
Now, it's so funny because I don't know if you ever like go to like a music show, like a rock show, and then like the band leaves, but then, the fans clap, which you just did, and then the band comes back on and they play some songs and you go, oh, that's my favorite song. Now, I don't know if that's ever happened, but I'm going to ask Dr. JK, an important question because for so many of our doctors that I'm looking at right now that are still large and in charge, totally engaged. Great to see you, Dr. Z. You know, Dr. Ziliaks, oh my gosh, where do I begin? So many of you, but a lot of you, I don't know if you know, but I think you do, but we're doing a private master class in Dr. Jason Kaplan's office, of which you were sent an invitation today. If you look in your email, it was already sent previously, but since the class is like 90% full, I resent it again today. So please go to your email if you didn't see it and get that seat reserved. We're doing a special training. Now, why is this so crucial, vital, and important? I'll tell you why. Because in 1,700 square feet, Dr. Jason Kaplan has monetized his clinic in a way that very few doctors have, meaning there is a spinal decompression specialty center under his roof. There is a peripheral neuropathy specialty center under his roof. There is a knee package program under his roof. Now, why do we come back to those three? The reason why is because if you ask Dr. Jason Kaplan, he's going to tell you that all three of those share in common one thing. What do they share in common? They're all cash models. They're all cash businesses. And that's what we teach. So what would you say, Dr. JK, in the sense that for those doctors that already have a reserved seat at the master class in your office, what can they expect when they come to your, because it is probably the most intense 4 hours, and you can maybe share a little bit about what your father actually does with a bell. What makes it so incredible?
So we actually have a product showcase. We have about 12 different stations set up. So you get a taste of the knee, the protocols, the actual treatment equipment, how everything works. You can see the whole entire neuropathy protocol, how we treat the patients there from step by step, the whole entire line, all the stuff that we use, the order that we use it in. Then you'll see the whole entire decompression area. We go over belting, we will proper setup, alignment, treatment, again, protocols on that. Then you get a little bit of chiro. So you actually get a taste of every single thing that I do in my office. You go through every single room. Every room is set up and laid out, and then you have doctor after doctor just educating on all the different things we do, the different therapies and the different protocols. So it is a very, very cool day because you just get hit with everything.
It's such an intense, laser focused dynamic in the realm of all the technology that you're using and how you've taken each room in 1,700 square feet and created a monetized model of success based upon medical necessity, based upon research, based upon packaging, based upon presentation, and based upon results. Because so much of your practice, if you would share this, I would love if you would just share this as we start to come to the finish line here, of a majority of your practice is so referral based now from the medical profession, meaning you actually get true medical referrals. And I think that's so interesting. If you could share that a little bit, and there's a reason for that as to why.
So I get a ton of medical, and the greatest thing is I actually have, if I ever have some actual patient come in, I do a consult, and they're a little bit skeptical. I tell them, I want you to come back at 6 p.m. Just sit in my waiting room. That is the last actual slot of the whole entire day. We call from 6 to actually 7, the last hour. We call it doctor hour, because all the medical doctors come from the hospital in their actual scrubs with their hats still on. And it's amazing how all the doctors who are doing all these surgeries come to get their own actual treatment. And then when you treat one actual doctor, they then send you their colleague. Then I get their spouses. Then I get their entire children. And then when they have a patient who comes in who's like, oh, doc, I don't know if I want surgery. I'm just not there yet. It's amazing. Well, there's a guy named Kaplan. You can go actually see him. So by me just meeting with actual doctors, getting doctors in the office so they can see what I actually do, it turned out to be betraying their friends, family, and then when you gain their trust, they then start sending you everyone, and it has just snowballed.
You know, it's an incredible dynamic. I love what you shared because there's such a ping pong here. So I would love for all the doctors to take notes on what I'm about to share. And I'm going to share one great takeaway with you based upon the genius of Dr. Jason Kaplan, which is this. You ready? Are you sitting down? Yeah, everybody's sitting down. Nobody stands up for a Zoom meeting, right? Well, wait a minute. If you want to increase your conversion rate, if you want to increase your close rate, raise your hand. Yeah, that's what I'm talking about. That's what I'm talking about. Then you want to do exactly what Dr. JK just shared. And you want to book new patients during your busiest times of the week. Now, what does most chiropractors do? What do most chiropractors do? They say, well, you know, I need a half hour with that new patient. I really need to focus on that new patient. I really need time alone with that patient. And if you want to totally wreck your practice, do that. We consistently, for years, brought patients in during the busiest times of the day. Our team, not staff, our team already knew the slots when they would book new patients. We always book new patients during our busiest times. We'll accommodate them, we'll work with them, we'll help them, and we'll use, if needed, the Disney World style of patient management. What's the Disney World style of patient management? That we won't let them sit in the reception area for 30 minutes alone. We'll move them to one area of the office. We'll move them to another area of the office. We'll get them a cup of coffee. We'll get them a cup of tea. We'll have somebody sit with them and fill out paperwork. We'll turn that 30 minutes to make it feel like 10 minutes. In the past, chiropractors used to use what's called jump seats. You remember that? That's old school. Remember that? So a patient, see, remember what Dr. K said before when he said, when you could see the invisible, you could do what? You could do the impossible. What you're doing is you're letting patients in behind the curtain, literally, where they're sitting there and they're watching patients get spinal decompression. And they're saying, oh my gosh, look how gentle, look how simple, look how easy, look how many people are waiting to get on that table, look how many people are in the therapy suite, look how many people are getting laser therapy, look how many people are getting knee treatment, look how many people are getting neuropathy treatment. This is like a standing room only. Listen, there's an old saying in business, people go where people go. Why? Because people go where people go. The worst thing in the world is walk into a restaurant with all the seats empty. Anytime I walk in a restaurant with all the seats empty and my wife, we look at each other. We get that look and we go, oh my gosh, I think there's some food poisoning coming. I'm feeling some botulism, some salmonella. There's no way they got to turn the food over. That's why I love going to a busy restaurant. I go to a busy restaurant because the food is turning all the time. Your odds of getting sick are like minimal. Go to a non-busy restaurant. It's just like that in a doctor's office. Book your patients during your busiest times, and all the heavy lifting will be done up front. These are little nuances, practice secrets. So guys like Dr. Anthony Pendolino, welcome to the family, doctor. I'm so excited for you in Illinois that just joined our family. Dr. Roger Lincoln, who has a seat now at the master class. So many doctors have seats at your master class, but for those who've been through this journey and understand that we're making history together, Life University, September 6th, www.thechirovent. I got a little text that said, better share it again. So I'm following your lead. Thank you, doctor, for keeping me on track. 888-990-9660. A bunch of you apparently have already called and scooped up seats. That's awesome. If you're able to get a seat, we can't wait to see you. You'll be in a room with so many multi-million-dollar entrepreneurial chiropractors that know the clock is ticking, that know that being a chiropractor is a calling, know that being a disc doctor is part of being the chosen, know that being part of Disc Centers of America is the best inner circle of chiropractors on the planet that are dedicated to saving patients from dangerous opioids, risky epidural injections, often unnecessary back surgeries, laminectomies, foraminotomies. Yeah, even metal in the back. Those slides we showed before of those graphics are actually in our new back surgery booklets, which we're giving out at boot camp on. We got brand new booklets we're giving out on the day before. And for all of you that hung out with us for all this time, you got to give it up to Dr. JK, because if it wasn't for him, this would have never happened. Yeah, it happens. We get storms sometimes. Sometimes the internet goes down, but he held his father's hand. Not easy to look. See, that's like even Dr. right? Even everybody's clapping, even Maya. Everybody, that's his daughter. And Ethan, too. If you're curious who Ethan is, that's their grandchild who has the same initials as his father. Yeah, ESK. It is a full circle. It is the best time ever. Look at that face. Look at that face. I mean, come on. Look at that face. That is the future. That is the future. We do it for the right reasons. We're so thankful to have all of you in our lives. We're so thankful that somehow, some way you jump through enough hoops. Yeah, I'm looking at doctors that jump through a lot of hoops. You know what I'm talking about. That got knocked down and said, you know what? I'm mad as hell, and I'm not taking it anymore. I deserve better. Yeah, you could say that. I want more. Yeah, you could say that. I want to give back. Yeah, you could say that. And I want to have freedom and a quality of life, because it doesn't take that many packages to change your life. The reality is simple. If you close one more case per week at $3,000, $4,000, $5,000, $6,000, $7,000, how would your life change? Well, instead of closing one per week, what if you closed one per day? How would your life change? What if I told you that there are doctors on this Zoom meeting? They don't close one a week. They don't close one a day. They close, are you sitting down for this one? One an hour. Yeah. They get 4, 5, 6, 7. If you were at the Cairo event last time, you met some of them. That's what they get. You know what that's called? That's called the $25,000 collection day. Yeah. That means you did 4, 5, 6 case presentations. 4, 5 said, you know what? I want to avoid a back surgery. You are the best option for me. I did my homework. I saw that Disc Centers of America has over 250 centers. You must be doing something right. You're the biggest in the business. There is no second place. And there shouldn't be. Because I know if it was me and I was a patient, what do I want? I want the same thing you want. I want the best. And I will travel to see the best. I will pay the price to see the best. That's my life. And guess what? You're exactly the same. Your patients are exactly like that. They want the best. So for all of our Disc Centers of America doctors, we're so happy. If you're not part of the family yet, guess what? You got our number. And for everybody else, we hope you get a chance to be there on September 6th. It'll be a game changer. You won't forget it. We made history together. Wait till you see what's coming and all the things in the pipeline specific to our relationship with Life University. We're in it to win it. Thank you for hanging out with us. We'll see you next time. No one better. And I'm talking about you. Thank you, doctors.